All right, welcome everyone. Happy Friday. I'm excited to welcome you all to our Wisconsin Coalition for Social Connection webinar, all about social prescribing, a new path to connection. So just to kick us off, if everyone just wants to drop in the chat your name, your organization, and just a quick icebreaker question, what was the last community event that you attended? So feel free to drop that in the chat, and while that comes in, I'll introduce myself. If you don't know me, I am Suzanne Morley. I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging. I coordinate the Wisconsin Coalition for Social Connection, which is bringing us here today. And the last community event I attended, I believe it was last week, Friday. Our little community, I live in the middle of nowhere, Wisconsin, in Adams County. And we have a really great farmers market that just started. So that was the last community event that I went to. So for today's agenda, we have a few different speakers that will be sharing a little bit about social connection. We'll have some time for Q&A towards the end after everyone has spoken. I'll give a few brief coalition updates and then we will wrap up. So before we go over to our speakers, I'm excited to introduce Maria Kugi. Maria joined the Wisconsin Coalition for Social Connection Network last summer and really was the first person that introduced me to the concept of social prescribing. So Maria, if you want to go ahead and share a little bit about yourself for everyone, that would be great.
Sure. Hello, my name's Maria Kugi, as I was introduced. I'm a social prescribing advocate in the Milwaukee area. I became interested in social prescribing in its many forms, arts on prescription, nature on prescription, that kind of thing, around 2018 or so, when the UK began implementing it nationally. So I'm so excited to see so many people interested and here on this call today. As you'll hear, social prescribing is a great way to address various social determinants of health, including, but certainly not limited to social isolation and loneliness. You'll see me in the chat, hopefully dropping some links as our speakers mentioned some resources. So hope you enjoy.
Yeah, thanks, Maria. Maria's graciously agreed to assist with this webinar, kind of serve as a sounding board for others in Wisconsin who might have questions about social prescribing after the webinar, but really excited that, this kind of came about from one of our, coalition partners and why we're here today. So with that, I am going to introduce our first speaker, Ivory Rose with Social Prescribing USA. I'll stop sharing and Ivory, I'll let you take it away.
All right. Hi, everyone. I'm going to get my slides up here. And I love the introduction question. So I will just share that the last community, my name is Ivy Rose. I'm an occupational therapist by background and also the lead for healthcare engagement at Social Prescribing USA. And the last community event that I attended was if this would count, a poetry open mic that I attended last week. So I identify as an occupational therapist and a poet. And so happy to be here today to just give you kind of an overview of social prescribing. I imagine that there are some people that are more familiar with it, and for some people it's a more novel concept or a new way of describing something that maybe they have been doing to some degree already. So a little bit about Social Prescribing USA. Our objectives in the field of social prescribing are to educate people, as we're doing here today, to advocate for the expansion of social prescribing, to facilitate also the expansion and adoption of social prescribing, and to lead in the field. And some of the things that we do, this is not an extensive list, but we do host quarterly webinars, as well as March 19th is Social Prescribing Day. So we always have an annual webinar on Social Prescribing Day, as well as quarterly webinars throughout the rest of the year. We put out a monthly newsletter, and I'll share the QR code at the end of my presentation if you want to sign up for that. And then we have two different kind of groups that meet monthly. And they're both kind of a community of practice, but one is our general community of practice. And that meets the first Tuesday of the month at 2 p.m. Central Time. And then our Health Champions group is really designed more for people, healthcare professionals working in traditional healthcare settings, And that is the second Monday in the evening, 7 p.m. Central Time. And again, I'll provide the QR code at the end if people are interested in joining. You don't need to have any expertise in social prescribing to join, just an interest and passion for the field. So everyone is welcome there. Now, I think I might be preaching to the choir a bit here, so I'm not going to go too much into the loneliness crisis. I think everyone here is probably well aware of the adverse health effects of loneliness. But just to name a few statistics, loneliness and social isolation have often been grouped together in research, and I think now are starting to be teased out more. But loneliness and social isolation have been shown to lead to a 29% increase in the risk of heart disease, 32% increase in the risk of stroke, a greater risk for developing hypertension than diabetes is, so a greater contributor to hypertension than even diabetes is. Also increased risk for diabetes itself, and about a 50% increase in the risk for dementia and 20% faster cognitive decline. And lastly, increased likelihood of developing depression or anxiety. And these are some statistics for older adults from Dr. Vivek Murthy's 2023 report. Now, for those of you who are less familiar with social prescribing, like I mentioned before, I'm a poet, and so I love to use poetry to illustrate as one form of learning. So I'm going to share a poem that I wrote called Less and More. We sleep less, scroll more, touch less, text more. We spend less time outdoors and hug less. We spend more time under fluorescent lights. We look at the stars less. We look at screens more. We see less stars even when we are looking. We set more timers in an attempt to be more productive. We visit more doctors for our health. The doctors spend less time with us because they have to see more patients. We live in places with more people, yet feel less connected and more lonely. We spend more, yet we are less happy. We live for more years, yet perhaps we are less alive. We drink more and drug more and smoke more just for a feeling of more dopamine, which only makes us produce less and need more. We listen to social media experts more and to our own bodies less. We suffer more anxiety and therefore talk to strangers less, not knowing that talking to strangers more may actually lead to more happiness. We judge ourselves more and believe in ourselves less. We are more alone and less in community. So what if we flip the script? What if we moved more and watched TV less? What if we spent more time actually in green places and less time just making them into our screensavers? What if we spent more time cooking and more time eating and less lunch breaks cramming? What if we helped each other more, even if we didn't think it was going to benefit us? Because side note, science says it always does secretly benefit us, as long as we're not doing it just for that reason. What if we spent more time together and less time in our silos? And what if we stopped waiting until we had more health problems before thinking about our health? What if we did more of what actually makes us well and looked less to doctors and more to ourselves as the experts in our own health? What if we looked more to nature and art and movement and eating food that actually has the nutrients we need, and to helping each other and to being in community? And what if instead of just paying for more doctor visits and more pills, which do have their time and place, what if our health insurance actually paid for more of what creates our health? Like going to poetry night or pottery class or riding horses in the park or healthy cooking classes or dance group or capoeira or stand-up comedy class for men who have survived a suicide attempt. Or even things that don't cost money, like walks in the park or volunteering. Well, I'm running out of time, so I'll just leave it here. In 30 countries, more than 30 countries around the world, Healthcare systems are actually paying for these things, and it's called social prescribing. So, my final question for you today, what if we looked less into bottles of pharmaceuticals for the answers and more into our own communities? So I touched on social prescribing a bit in the poem, but I'd like to share this visual with you that I've created. So social prescribing is a pathway. So it's not one component of the pathway, it's the entire pathway. And parts of this have been happening for years, but this pathway as it is a bit unique. And we'll talk about why that is. So, the first step, someone typically in the healthcare system, but not definitively only a healthcare worker, identifies that there's a social need that's impacting someone's health and well being. They then refer them to a connector. And we'll talk a little bit more about that role and what that entails. But that connector then has a conversation with the patient and finds out what matters to them and helps co create a referral to engage in a meaningful activity in the community. And it could be other types of support as well, which I'll touch on, but often it's engagement in meaningful activity. And then if you can see the arrow going back, there is a loop where outcomes are assessed for changes and improvement in health and well-being outcomes, loneliness, various types of outcomes have been taken. And that information is then fed back to the connector or the identifier. So it's kind of this circular loop. And social prescribing, like I mentioned in the poem, is happening in over 30 countries around the world. I think 33, the last count I heard. So obviously, it's happening differently in different countries. So there's a lot of variation. And then there's also a lot of variation in what is prescribed. And so that is definitely one challenge for comparing different programs and outcomes as people are engaging in various different types of activities or receiving different types of support. And recently, I read an article that describes social prescribing as a series of relationships. And I just really loved that term because there's the relationship with the healthcare provider. And we know that healthcare providers are spending less and less time with patients. But they might not be able to help directly refer someone to a resource. They may, in some instances, right? You can see this arrow at the top alludes to the healthcare provider may not use a connector, they may directly refer. But with the less and less time that healthcare workers are able to spend with their patients, that's really, has quite a few challenges to do that, especially if they're not going to see the patient again for a while. Um, Another relationship is the relationship between the patient or client and the connector themselves, which is really shown to be a very important part of the process. And then there's the relationships that are formed at that community activity with maybe the instructor or the other participants. So I just loved that description that it's a series of relationships. I thought that was such a poetic way of describing social prescribing. So I kind of touched a little bit on a few of these, but at the connect phase is really a very important part of the social prescribing pathway. And in different countries and different settings, even within the same country, there's over 30 terms. And different people from different backgrounds are filling this role. So it's not always someone with the same professional background. In, I think, two countries, I believe it's Portugal and the Netherlands, use social workers. In the UK, where social prescribing kind of was coined and is said to have originated, um, they use something called a link worker, which is typically an entry-level position that has some training, but isn't a specific discipline. And Other countries use terms like a community navigator or a community connector. So there are many different terms for this person that does the connect phase. And just want to emphasize again what a vital phase and role this is. So some of the key ingredients for the connect phase, and this is taken from Moll et al.'s universal definition, which was defined in 2023 by a Delphi study where people from around the world that were involved in social prescribing were able to contribute to a universal definition so that we could start to speak the same language somewhat around social prescribing. So these are the key ingredients as defined by that universal definition. Part of it is individualized support. So it's not referring everyone to community choir or everyone to painting class or everyone to nature walks. It's really having this. You may have heard the term, it's not what's the matter with you, it's what matters to you. That's kind of become a catchphrase in social prescribing. And so a what matters to you conversation means it's an individualized conversation because what matters to each person is going to be different and distinct depending on their unique interests. Now, the second key ingredient, which I think this is an area that we were really less equipped to deal with before social prescribing, is assistance with barriers. So if you think about the elderly clients that you support, and you think about some of the barriers that may get in their way. So, like I said, I'm an occupational therapist. Some of the barriers that get in the way for my patients is transportation, the cost of attendance of an activity, the accessibility of the activity, their endurance, having enough energy to, make it out into the community and take part in something. So providing assistance with barriers is a key part of social prescribing. It's not just saying, here is an activity that you'd like to do, and here's a place you can go do it. Good luck. Because we know that our seniors need more support than that. So it's really providing assistance and therefore funding that activity is a vital part of that. Another key ingredient is support for behavior change or motivational interviewing. So, kind of digging a little bit into beyond those barriers, what else might be getting in the way and keeping someone from taking part in activities in the community that are already existing. Another key ingredient is empowerment. So, really encouraging that person to have greater agency over their health and well being. So, instead of the kind of secrets of health being owned by the doctor and the power that they have to prescribe medication or not, it's really putting some more power back into people to realize that, as we know, approximately 80% of our health is what happens outside of the healthcare system. So really giving some support so someone can have more agency and taking advantage of the resources that can support that. And then finally, as I mentioned before, co-production. So the prescription for a community resource or activity needs to be co-designed between the connector and the client is a vital part as well. Now, types of prescriptions I mentioned a bit. Some are basic resources like assistance with food and housing. There are also prescriptions for things like education, language lesson, training. Um, there are also lifestyle support and groups. And then I think the meat of what we're really hearing about in the US is engagement and meaningful activity. Now, as an occupational therapist, I can't help but throw in the term occupations. And you might wonder if you're not from an OT background or don't work with an OT, you might wonder what that means in this context. So the word occupation means the meaningful activities that we occupy our time with. So it's not just our job, although we probably all occupy a lot of time with our jobs, but it is the meaningful activities that bring purpose to our life and that we occupy our everyday lives with. And we know that that leads to health and wellness. So when we're prescribing engagement in an art class or a nature walking group or a gardening group, we are often helping people socially connect, but through engaging in occupation. So it's through that meaningful activity that people come together and connect. And Julia Hotz, many of you are probably familiar, wrote a wonderful book that came out last June called The Connection Cure. And she spent years traveling the world and studying social prescribing in different countries. And she saw that of the meaningful activity prescriptions, they often fell into five categories. And I'll go through the categories first and then say what I was going to say. So those categories are art, movement, nature, service, and social belonging. So I would say that often, if we're looking through it through the lens of an occupation or a meaningful activity, something doesn't fall just into one category, right? And you can even see this in the pictures that I've shared here. So we have someone engaging in art, and also it's a social scenario. We have someone volunteering, and again, it's part of a group. We have someone dancing, um, people bowling. So they clearly are taking part in movement and also social connection. And then there's some photos on the right that show engaging in nature, movement, socialization, that really we find multiple components of these things in many activities and groups. So just a very brief overview of some outcomes. So at the bottom here, I've cited the source, which is from the National Association for Social Prescribing, or NASP, which is the United Kingdom's version of Social Prescribing USA. And since they've been doing social prescribing formally since about 2019, they have a lot more research built, and they have a wonderful online resources of evidence briefs. And there's some specifically about older people. And so that's the link at the bottom there. And so some of the outcomes specific to older adults is improved function, cognition, loneliness, mood, and subjective health, well-being, and interaction. Also decreased emergency department utilization, hospital admissions, and depression are a few of the outcomes. Now, I've talked about social prescribing outside of the US and mentioned that it's in over 30 countries around the world, and that it originated, as we know it now, it originated in the UK. But you're probably wondering, well, what about right here in the US? And you're going to hear about Wisconsin specifically with the next speaker. But this is an overview from the Social Prescribing USA website. And you can look at that link, or you can just go to our website and find our initiative tracker. And where you see a number, it means that there's more than one program or more than one location in that city. And so you can see that social prescribing programs are happening and starting to flourish in the US, and that we also have a lot more room to develop more. And some of these are multiple sites of the same program, or some of these are also different unique programs. So as you zoom in, it will provide you with websites and TED Talks and reports and all sorts of information about the different programs so that you can start to look at what's happening here in the US. And looks like we're right on time. This QR code is going to take you to the Get Involved page of our website. And that has three things. It has the link to the newsletter, where you can sign up for the newsletter. It has a sign up for the community of practice, which is the more multidisciplinary one. And although all are welcome at both. And then it has the link to sign up for the Health Champions, which is really more focused on people that work in healthcare or come from a healthcare background. And so I invite you all to scan that QR code and stay in touch with us. maybe starting with the newsletter and maybe also joining us for one of those groups. I also put my Social Prescribing USA email address at the bottom. I'd love to hear from you and stay in touch. And I believe that is my last slide. Yes, right on time there.
Perfect. Thank you so much, Ivory, for that great, kind of introduction, overview, sharing of your art with that poem, really kind of setting the scene and painting the picture of what social prescribing is. We're going to switch gears a little bit and move into what is social prescribing in Wisconsin. So I am going to turn it over to Taylor, who's going to share about the Wisconsin Social Prescription Pilot Program.
Thank you so much, everybody. Thanks for being here today. My name is Taylor, and I work for the University of Wisconsin-Madison's Extension Division. And like Suzanne said, I'm excited to share with you this kind of new and innovative social prescribing grassroots initiative that's happening right here in Wisconsin. As Ivory mentioned, it's also known as social RX, right? Which is an evidence-based practice, both in the US and across the globe, where health providers are prescribing free of cost arts, culture, and nature activities in community settings to holistically address an individual's specific health needs and unmet needs. And so this innovative grassroots approach that I'm going to talk about today really aims to improve the mental, physical, and social well-being for vulnerable populations, both in rural and urban Wisconsin communities, including older adults, youth, individuals with disabilities, and marginalized communities. So first, I'm going to just kind of talk through who's a part of the steering committee for this initiative, highlight some critical health issues that we're seeing in our communities, and then how we're going to foster new partnerships to address these health needs in Wisconsin. And so this committee is made up of a combination of many different arts, health, and academic partners across the state, including Art Start Rhinelander, Children's Theater of Madison, Create Wisconsin, the Dane County Arts and Cultural Affairs Commission, First Stage Milwaukee, Florentine Opera Company, Rural Wisconsin Health Cooperative, UW-Madison Extension, and the Wisconsin Arts Board. And we intend to launch this initiative in 3 locations simultaneously, and I'll get a little bit into that. So we really wanted to make sure we had specific partners in specific locations, and then also some statewide partners as well. And as we are all well aware, and as Ivory had mentioned as well, we know that the United States is experiencing a mental health crisis. We see concerning data, particularly around young people in this country, struggling with mental health, shortages of mental health providers, with, of course, disproportionate effects in low income and rural areas, and how much that this causes strain on our healthcare systems. And if it's happening on a national scale, of course, it's happening here in Wisconsin. We see mental health disparities among youth. We see alcohol-related incidents, opioid use, and addiction rates just continue to increase across our counties. And many Wisconsinites face challenges in accessing affordable and timely healthcare, and report feeling really disconnected and isolated from their communities now more than ever. But of course, we don't have to show you this data for you to know, experience, or see this in your own communities. And so, as mentioned at the beginning of this presentation, and what everyone's here to talk about today, social prescribing, or social RX, is this innovative and evidence-based practice in both the US and across the globe, where health providers prescribe arts, culture, and nature activities free of cost for patients in community settings to holistically address an individual's specific health needs. And we want that to happen here in Wisconsin. And despite Wisconsin actually being ranked 49th in the US for per capita public funding for the arts, arts and culture in Wisconsin has a $11.9 billion with a B, dollar economic impact with over 89,000 jobs. And so we just really like to imagine what we could do for our communities when all of these different sectors come together to say the arts are a necessary service for our economies, for our communities, and for our health. And so that's why I'm here today. And the Wisconsin Social RX pilot program really seeks to address these critical health needs that I mentioned before, by connecting individuals to these arts, culture, and nature programs that can improve their mental health, address chronic disease, reduce isolation, and enhance overall quality of life. And so to do that, we specifically are seeking funds and are in the middle of fundraising right now to partner with an organization called Art Pharmacy. And they're a nationally recognized company that's based in Atlanta, Georgia. And they have assisted communities and states across the country to implement social prescribing. And what's great about Art Pharmacy, bringing them on as a partner, is they act as a bridge between healthcare providers, arts, culture, and nature organizations, and third-party payers to really streamline access at no cost for patients when they go see their primary care providers. And their evidence-based model really fully integrates arts, culture, and nature into the ecosystems of health systems and third-party payers, while simultaneously collecting HIPAA-compliant health outcome data to demonstrate the efficacy and data-driven results of how powerful the arts can be to address health. And so by partnering with Art Pharmacy, we accelerate this social prescribing process in Wisconsin, where if our fundraising efforts are successful, providers could be prescribing their first dose as soon as next year. And so before we get into the data and kind of some of the logistics of where we are in the pilot, Ivory kind of touched base on how this process works. So I'll just kind of go over it briefly. But when this is implemented and when we bring Art Pharmacy on as a partner, health providers within this Wisconsin Social Art Network really refer patients to these locally hired care navigators. And care navigators provide a selection of arts, culture, and nature activities that can address that patient's specific health needs, as well as make sure that it's suitable for a patient's mental and physical capacities. Patients choose their program, and additional needs are supported as well, such as a complimentary companion ticket or transportation assistance. And Art Pharmacy purchase tickets through these arts, culture, and nature organizations, which makes it free of cost for patients. Patients engage in their activity, the care navigator, patient, and then their original primary care provider evaluate progress, evaluate their health outcomes, and initiate refills. And so this model of care, as mentioned before, has really been implemented, especially in the UK, with great success. And for social prescribing here in the US, right, this is a relatively new initiative, but has some really promising results. And specifically, when we focus on the work that Art Pharmacy is doing, they have worked with a variety of health systems in different states. And from their pilot programs, they've really seen some incredible outcomes as a direct result of social prescribing. And so the beauty of this model of social prescribing in general, right, is that it not only benefits the patients, but it benefits the entire healthcare and arts systems. Providers share that they experience feeling less burnout because they're actually prescribing their patients joyful and additive treatments. And health insurance companies actually see a reduction in the financial burden of mental and physical health consequences. And arts, culture, and nature organizations receive financial stability by being introduced to new audience members. And of course, most importantly, patients feel connected to their community while improving their health in a different way through arts engagements. And this data is collected and disseminated as part of this pilot process to demonstrate its impacts. And so we would be the first Midwest state to partner specifically with Art Pharmacy, really setting Wisconsin as an innovator and leader in connecting arts and health. And so again, the steering committee is really making great efforts to have this pilot program launch in 3 different locations simultaneously: Dane County, Milwaukee County, and a rural area. We're kind of looking currently at the Door County area or Oneida County area, with the intention, of course, to implement this social prescribing social prescriptions statewide after the pilot is complete. And so phase one, which is the phase that we're currently in, really consists of raising funds to secure a partnership with our pharmacy, which then begins to implement that social prescribing infrastructure. And then the steering committee raises the remainder of the expenses for the pilot program. Phase two consists of Art Pharmacy and the steering committee really working together to develop this ecosystem of key stakeholders, including health providers, arts and culture nature organizations, and third-party payers. And so once all of these partners are vetted and identified, all of these key stakeholders receive training and education on trauma-informed practices, cultural awareness, sensitivity, and patient safety. And during this phase as well, care navigators are locally hired and trained and certified to begin working with individual patients. And phase two kind of ranges from 6 to 9 months to really build this vital ecosystem of stakeholders. Phase three would be the official launch of providing prescriptions, where kind of prescriptions are given over the course of a 12-month period. This is where prescribing partners write social prescriptions to their patients. Patients are referred to their care navigators, and then care navigators supports that patient in, choosing their preferred activity. Art Pharmacy and the steering committee helps collect and measure those data demonstrating the impact and success of these particular social prescribing interventions. And then all of that data is presented to the third-party payers at the conclusion of the pilot program. And in the final phase, again, with the dissemination of these impacts and all the data that was collected, third-party payers recognize the financial and health benefits of social prescribing and buy into the program, committing to providing coverage post-pilot. And so, like I mentioned, this is a very new, very grassroots initiatives. We're just getting started, and we're just so excited to continue to talk to everybody and learn more about who we should be talking to and who we should be connecting with. And so thank you so much for your time today. I really appreciate it. Please let me know if you have questions. I also have my email that's listed on the slide, so please don't hesitate to reach out. Thank you so much.
Thank you, Taylor, for sharing all of the great work that's happening. As I was kind of hoping to put together a webinar about social prescribing in Wisconsin, I Googled social prescribing, and the Wisconsin Social Prescription Pilot Project came up. And then also, I will pass it to the next speaker. Stacy was the other project that showed up as well. So I'll share my screen and let Stacy introduce the work that Sage is doing with social prescribing.
Yeah, good morning. So my name is Stacy Von Bush. I am trained, just for a little backstory on me personally, as a community engaged artist through the Time Slips organization. In 2021, I took on a project through the ADRC of Brown County to specifically, as an artist, address isolation and loneliness in our elder population. However, Sage goes back to 2017 when, as an artist recently moving into the state of Wisconsin, I formed an artist support organization, which has transitioned quite a bit over the last few years to really be that advocacy piece. One of the facets of Sage is identifying in Brown County, which includes the greater Green Bay area, how we can be different as an arts and culture organization. So in 2024, I read that beautiful Connection Cure book and I went down a rabbit hole. It's been quite valuable for us as an organization to spend a good 6 months plus diving deep into what social prescription might look like for us as an organization, as a grassroots, completely volunteer-based organization, a little bit more infrastructure for you as far as what we're dealing with. And say, how can we address isolation, loneliness, and mental health in our county, including both the Green Bay area and some of our rural communities, including Pulaski, Denmark, and Wrightstown. All of those communities are around a population of 4,000. And how can we bring arts programming and arts infrastructure into those communities while serving the mental health, sense of belonging, and community well-being? Introducing the social prescription calendar. For us, it was taking organizations and partners that we had worked with previously in the Brown County area and identifying free arts and culture events that we could put collectively on a single calendar. This proved very worthwhile for us as organizations, because one of the things that we all address collectively is participation, and having individuals that come to us with great ideas and perhaps want to host programming or want to participate or even want to volunteer, but making sure that we also have the people that want to participate in what it is that we have to offer. In January of 25, we gathered around 20 different organizations. You've heard terminology such as healthcare providers, link workers, and then your community organizations that are doing the work. And I do want to back up a little bit. This is an informal approach to social prescribing. I'm going to get a little bit more into that. As far as for healthcare providers, we worked with individuals through family services, individual counselors, providing them with information pertaining to the social prescription calendar in Brown County. We worked with individuals that were working within their own counseling services, or perhaps even working as life coaches. So a lot of different possibilities there, and not simply like our Brown County Health Department. Link workers, we identified organizations that are out and about in the community, addressing different demographics, different ages. I will say SAGE serves the population ages 16 and over primarily, with a big focus on that, let's just say 20 to 40, those individuals that perhaps are seen as working full-time, raising families, and not provided with quite as many opportunities to engage in their community. No reason why for it necessarily, but we were those individuals, and so we wanted to be able to provide more opportunities to engage. So link workers, examples of organizations that we reached to that we had previously partnered with would be like Bay Area Council on Gender Diversity, Green Bay Crime Prevention Office, organizations that we knew were hosting things like support group services or outreach, that we could present them with this card that you see right here. So it's a social prescription calendar card. It is something that we empower all of our partner organizations and those link workers, and of course our healthcare providers with. That QR code just takes you straight to our website and straight to the calendar. The calendar has a variety of events from our organizations, from music to free art classes to free day at the Brown County Neville Public Museum. Just kind of anything that we knew was quality programming, having previously worked with those organizations, and at the same time impactful programming. So we knew that the Tarleton Theater, for example, had a really great reputation with hosting music and hosting programs, but also having wonderful community engagement. Because though we might send an individual to a concert that would have 100 attendees, we wanted to make sure that there was also an opportunity for them to have one-on-one engagement. And what would that look like? So we don't partner with just anybody. The free aspect really provided us with accessibility to things like this. For transportation purposes, if the program is not within walking distance, like for Green Bay, we're located in the greater Green Bay downtown area. So we're close to bus lines, we're close to underserved communities, we're within walking distance of a lot of places. Pulaski, rural community, pretty much everything's in walking distance in Pulaski, let's just be honest. But really partnering with a wonderful service organization out here called Pulaski Area Community Education. It's a branch of our school district. I say our because I live in Pulaski. I will also add, I double as the executive director of the Pulaski Area Chamber of Commerce. So it really allowed me in this rural community to address community development and well-being through participation and engagement. When it comes to what does a prescription look like with the social prescription calendar, we actually advocate a lot for what we refer to as self-prescribing. Though we don't just have this card out like on a counter, you're not going to walk into a coffee shop and see the card readily available. We do firmly believe in that link worker engagement and that one-on-one introduction to the calendar, having good conversation with an individual over what programs we're aware of that might be of their benefit through participation. We also make that calendar readily available on our website so anybody can access it. If you want to self-prescribe something, because we advocate that as little as once a month, participating in your community is known to have great effects on mental health and overall well-being, that you can do that. We partner with the Oneida Nation through their library, the Oneida Nation Arts Program. We've co-hosted events with. It was really a matter for us as an organization to take what we have identified for years, right there, that sense of belonging. So I will tell you, as a pre-COVID grassroots volunteer-based organization founded right in Green Bay, one of the greatest aspects of our organization was feeling like family every time we got together, was feeling that sense of connection, was leaving what we would host as a monthly meeting and feeling just greatly empowered and re-energized. And how could we continue to cultivate that for our community while also being intentional with how we were cultivating that space? So you never saw SAGE as an organization like boldly advertise our programs or intensely advertise our art exhibitions. We wanted to make sure that people wanted to be there and that they intentionally sought us out or were intentionally referred to us by someone who had already experienced some sort of programming that we had participated or contributed to in the community. So what you see here in front of you is various aspects. Our strongest program as an organization that's been in existence since 2019 with a few different names is called Open Studio. It's a very simple program where we set out art supplies that have been donated to our organization and allow anyone from the community to come in and make use of those art supplies at no cost. However, a really key component of that program are the artists and the individuals that are volunteering to be present so that that program can happen. We greatly emphasize a compassionate space of engagement, encouragement, peer-to-peer mentorship, because a lot of the individuals that come into our space either have previous experience as art entrepreneurs or individuals that are working in arts programming. Like there's a gal in one of these photos I can see here with that fuchsia hair. She works in the childcare program for the YMCA here in town. But empowering her to take that sense of community belonging into her workspace and to empower basically those kids that maybe SAGE isn't directly serving, but now we indirectly are. I can rattle off all of our partner organizations just to give you examples, but I think our approach to social prescribing was coming from a space of, number one, grassroots, number two, being volunteer-based, and number three, as has been the SAGE way for many years at this point, working from a shoestring budget. And how could we have the most amount of impact in doing something and being the most efficient with our time for our community? And how could we really drive purpose for these individuals that were not only participating in our programming, but then going on to be volunteers and community engagers themselves in other facets. So upper left on your screen is a free program where that gal in the middle did mosaic tiles with the Pulaski community outside of North Shore Bank as part of a celebration. Identifying third spaces and quality third spaces. I know many of you probably have physical locations, and SAGE does in Green Bay, but we don't in Pulaski, we don't in Denmark, and we don't in Wrightstown. So identifying good third spaces to produce this programming in these rural communities was also very important for us. North Shore Bank had been a great supporter of the arts. That was actually the event where we made the announcement that we were going countywide as an organization, as opposed to having previously served only the greater Green Bay area. Free event. Middle photo, Open Studio. What was really great about Open Studio is University of Wisconsin Green Bay, obviously, is right here. And some of the arts instructors were offering extra credit for their students to come and participate in our programming, encouraging them to be a part of local community engagement. So your school systems can easily become a partner in getting social prescribing off the ground. Again, we work with the Oneida Nation. So that upper right there was a multifaceted arts program where we activated artists from different artistic mediums on 3 different floors of the Bellin Building in downtown Green Bay to produce programming free of charge for the community to come out and participate and learn more about what our artists have to offer. This is a very empowering space for artists in our community, both in rural and in the greater Green Bay area, and of course the Oneida Nation. We also worked with Casa Alba Melanie, which is your bottom right there. That's a little bit different program. So that was their elder population. SAGE has a program called Creatively Engaged Community where artists come in as mentors and they help these individuals that are participating in whatever programming share their stories through art. And I will tell you that every time that we have hosted Creatively Engaged Community, we host an exhibit of the work that's completed. And it is of 100 times greater value to see those individuals who have created the art react to their art on the wall in exhibit form than it would ever be for the community to come in and see that art completed. It's a really beautiful space. I encourage you that as you host arts programming and as you look to social prescribing and arts and culture, that you would also showcase the work that is completed because it really does create a sense of belonging and worth for those individuals. What else can I share with you about social prescribing? You know, for us, this has been incredibly purposeful as an organization, as volunteers, as artists, as change makers. I can, go on and on about what that feels like as far as assessing whether or not it's working. Informal, once again. We will reconvene with our partners in October to go over how things are going, if they're seeing response. I will tell you that this rather informal, collaborative partnership space that didn't require us to go after dollars in order to initiate such collaborative effort has really energized our arts and culture sector with feeling like we have purpose and worth. And so when I walk into family services, as I did just yesterday with my daughter to take her to her counseling session, and her counselor says, yeah, I've been handing out those social prescription cards to some of my clients. And on the back of the card, we actually have recommended for you. I don't know if you can see that. So the counselors can put 4 programs that they believe are link workers or even the community organizations, because we really believe that those community organizations that have an understanding of who our partners are can also prescribe things for these individuals and how they might benefit through community engagement and participation. But the enthusiastic response of, yeah, I handed out some of your cards, or just knowing that we're in this together, that solidarity space has really proven to have great value for us. And I look and see that I'm at 11:52 and I'm a yacker. So I want to make sure that we leave space for questions. But my website was listed. Please be encouraged to reach out. createwithsage@gmail.com is our email address. Thank you for this opportunity to share.
Thank you so much, Stacy, for sharing that, that grassroots level example of social prescribing in Wisconsin. It's really great to see kind of from the beginning with Ivory, that 101 to this in practice. Before we move on to questions, I'm just going to give a few updates. So coalition updates. We do have another pop-up network webinar coming up on June 12th. We'll be kind of exploring Brown County again a little bit on their Spark program. So Sparking Connections for those with memory loss and their caregivers. The link to register for that will be sent out with the webinar recording and is also on our website. And then I just wanted to highlight Global Loneliness Awareness Week as well. So that is coming up in a couple of weeks, June 9th through the 15th. We do have a listing on our website and encourage you, if you do plan to do some sort of activity, event with your organization or just yourself as an individual, to tell us one way that you are going to meet loneliness together, which is the theme for that week. So again, that is on our website and will be sent out with the recording of this webinar. But with that, I am going to stop sharing for a second. And are there any questions for any of our speakers today? a little bit of time here.
I have a question for one of our speakers. Stacy, loved hearing about, I heard a little bit in email before, but loved hearing your presentation and how you were able to create something so wonderful with very little resources. Um, and you mentioned one difficulty in like finding sites. Have you partnered with libraries at all in some of
Oh
those
yeah.
rural areas? Yeah.
Absolutely.
Mm-hmm.
Yeah. So actually, I should have mentioned them. They are one of our partners, Brown County Library System. Part of the reason why we went into Denmark, Wrightstown, Pulaski is because there's a library here.
Yeah,
And in
wonderful.
fact, Pulaski's poised to get a larger library. All of them are. But I'm on a committee to raise funds for that space as well. But absolutely, libraries are invaluable here in Brown County.
Yes, wonderful. Thank you so much.
I'm not seeing any questions in the chat. Oh, go ahead, Lynn. I see you just came on.
Yeah, thank you. This has been super interesting, and I am curious if any of you have experience using an app to or kind of what's the mechanism in addition to a website for tracking participation, maybe calendar, but also like maybe reaching out with some like notifications, and maybe sending out surveys, things like that. Any experience using an app or other kind of tool?
I can speak to that. There is a company called Kenji Health, founded by Nora Hackman, and I can't remember. Thank you. Maria is so great with the resources here. Um, and they developed a chat AI bot, which works through the platform of WhatsApp and engages with someone as they are engaging in their prescription and checks in with them and does basically some assessments to well-being. And then they've actually compared that with the outcomes from standardized outcome measures like the Warwick-Edinburgh mental well-being scale, and found that it's actually highly correlated with the outcomes, and that the people really enjoy the interaction with that chatbot and don't enjoy so much, filling out the surveys. So that's one thing that comes to mind.
Good question. Thanks, Lynn. With our remaining few minutes, I was just going to ask, maybe start with Ivory and each of you. What is your advice? If you have any advice, if someone wants to get started with this, what would you tell someone? Yeah, Taylor, go ahead. I see you came off mute too.
Go ahead.
I mean, there's so many, I'd say if you just want to get started, and I know Maria would probably say the same thing, but the Center for Arts and Medicine is really this amazing resource. We both have degrees from the Center for Arts and Medicine. They do some really amazing, not only just graduate programs for people who are interested in the arts and health field, but they also really do an amazing job of just pumping out, pushing out, highlighting all sorts of resources. So based on, it could be research, it could be toolkits, it could be highlighting things that other organizations in the US and across the world have done. So I would recommend the Center for Arts and Medicine just as a way to, not just for social prescribing, I would say like for arts and health as a field, as a practice is a great way to start. And you can really just see the wide variety of things that are happening and that are all evidence-based.
So because social prescribing is an all ages, all population approach, there are so many things that can be done with it. And I think when someone has passion for it, it can be overwhelming. Like, where do you start? So it's such a great question, Suzanne. And when I was at the Canadian conference last fall, I asked Kate, who is the head of the Canadian Institute for Social Prescribing, where do you get started? And she said, what matters to you? And it was such a perfect question, right? And I thought, oh, my background is in working with the homebound elderly. And so that's where, so really starting where your passion is, and then also finding other people in your area that are passionate about the same thing, and how can you kind of put those resources and start weaving things together. That's what I
I
would
love
say.
that. Yeah, and I kind of saw
Yeah.
Stacy, that's kind of how you got
Yeah,
started.
I was just
So,
like,
go
well,
ahead.
she took my answer. So. I mean, absolutely. So obviously arts and culture, as an artist, I was passionate, for me / us as an organization, and then partner. I think the conversations to get the ball rolling were easier for us as an organization with people that we had already worked with, because we already had good relationships with them. But it doesn't have to be a big and scary process. Do your research, educate yourself, occupy a space where you're constantly learning and open to learning, because there's so much information out there right now, which, as a side note, my application is in process for a MA in Arts and Medicine through the University of Florida. So like, yay. I'm coming, guys. So thank you.
Maria, anything to add? I know we're kind of running out of time, but
No, they all did a great job.
awesome. Awesome. Well, thank you all. Thank you, Ivory, Stacy, and Taylor, for sharing. Thank you, Maria, for dropping all those links in the chat. We obviously have some great advocates in Wisconsin for this social prescribing. When you do close out of Zoom, you'll be redirected to an evaluation survey. So would appreciate if you would fill that out and stay in contact with the coalition. We have some great events coming up and hope to see you all at some in the future. Have a great weekend, everyone.